Salam, welcome to our new playlist titled Top Pharm Reaction. This will be a super high yield review for the important drug side effects. It can help you in different medical boards exam as well as in your clinical practice. So without further ado, let's get started. Today's question state: a 35-year-old male presents to the emergency department with headache, blurry vision, flushing, and tinnitus. He has no past medical history and the only medication he takes is hydroxychloroquine. He recently started this drug for malaria prophylaxis since he is planning for an overseas vacation. What is the most likely diagnosis in this patient? So the first adverse effect that we're gonna discuss is Cinchonism. It is caused by the anti-malarial drugs quinine, quinidine, and their derivatives like chloroquine, mefloquine, hydroxychloroquine, etc. Now, Cinchonism is a range of signs and symptoms, including headache and confusion, tinnitus and hearing problems, blurred vision, diplopia, as well as general symptoms like sweating and flushing. So the main thing is to associate that quinine and quinidine cause Cinchonism. And you can easily remember this association if you slightly change the pronunciation from Cinchonism to Cinchonism. So the Q in quinine, the Q in quinidine, and the letter Q sound in Cinchonism. The next adverse effects will be related to the antihypertension class of drugs, known as angiotensin converting enzyme inhibitors, ACE inhibitors. These are the drugs that ends with the suffix pril. For example, enalapril, captopril, etc. So the two important adverse reactions associated with ACE inhibitors are dry cough, which is the most common adverse reaction, and the lethal adverse reaction, which is angioedema. On one hand, dry cough is self-explanatory. It's a constant cough with no sputum. On the other hand, angioedema can be defined as swelling of the mucosa, which usually involves the face, the lips, the upper airways, which might impair the air entry into the lungs, the mouth, and the preorbital region, which is the region around the eyes, as seen in this picture. Since it's frequently asked on board exams, especially step 1 and progress tests, let's briefly talk about the mechanism behind how angioedema and dry cough are formed. So normally, ACE, the enzyme that is present in our body, converts angiotensin 1 to angiotensin 2. In the same time, it converts bradykinin to its active metabolites. This is a physiological process. Now, whenever ACE inhibitors are ingested into the body, they will inhibit this conversion. That will result in the buildup of bradykinin, and bradykinin by itself can cause irritation of the unmyelinated C fibers in the bronchioles, causing dry cough. Now we can go back and complete our discussion on dry cough and angioedema. Let's say a patient came to you with a dry cough or angioedema after using ACE inhibitors. What would you do? In other words, how can you manage these side effects? The answer will be, first, you should stop the ACE inhibitors, and to control the patient hypertension, you can switch to ARBs, angiotensin receptor blockers, and that will be enough. But in case of angioedema, you should also monitor the airways, since the swelling can obstruct the flow of air into the lungs. So how can we remember these adverse reactions that are associated with ACE inhibitors? Remember the April cough. A for angioedema, pril to remind you of the drugs that cause these effects, because ACE inhibitors ends with pril. And lastly, cough to remind you with the dry cough. So again, remember April cough to help you recall these super high yield reactions. Now for the last adverse reaction, I want you to imagine that you are in your clinic doing a routine colonoscopy, and on the screen you are seeing this. Instead of the normal, smooth, pink colonic mucosa, you are seeing this. What is your diagnosis? This is what is known as Melanosis Coli, or literally a black colon. Melanosis coli is caused by the stimulant laxative, Cinna. This is a benign condition with virtually no complications. And as they say, when someone gets a lot of stress, quote to quote, excessively stimulated, he or she will get burned out. Similarly, the chronic use of laxative Cinna is causing excessive stimulation for the colon. And I easily remember this reaction by thinking that the excessive stimulation is causing the color of the mucosa to burn out and become blackish. So remember, Melanosis coli is associated with stimulant laxatives, classically by Cinna. Now for our fire summary from A Little Bush. We have discussed that quinidine and quinine cause Cinchonism. ACE inhibitors are associated with dry cough and angioedema, and Cinna is associated with Melanosis coli. So let's finish up by answering our question. Again, a 35-year-old male presents to the emergency department with headache, blurry vision, flushing, and tinnitus. He has no past medical history, and the only medication he takes is hydroxychloroquine. He recently started this drug for malaria prophylaxis and he is planning for an overseas vacation. What is the most likely diagnosis in this patient? A. Angioedema. B. Cinchonism. C. Stroke. D. Meniere's disease. So you have a patient with a collection of unspecific signs and symptoms. And the key statement provided in this scenario is the one in red. He has no past medical history and the only medication he takes is hydroxychloroquine. Whenever they give you someone with no past medical history and they tell you the name of the drugs he is taking, try to think about the side effects of these drugs. And as we discussed, hydroxychloroquine is associated with Cinchonism. And if we again notice the patient having headache, blurry vision, flushing, and tinnitus, which are the classical presentation of Cinchonism. So again, the answer will be B, Cinchonism. Thanks for watching, and as always, see you in the next video. Salam.